Right, Bernard. We're just waiting for the audio-visual magic to happen with the slides, fingers crossed. Hope everybody's had a good day. There we go. We've taken some feedback from everybody who took notes at the workshops. There will be a summary of all of the notes that were taken that's circulated, and I believe all of the slides that you've seen today will also be circulated. So even if you didn't manage to go to everything that you were interested in, you should still get a good summary which you can take back to the ranch and continue the discussions there. So the summary from the workshop, we've gone into a different slide, okay, just to confuse me. Fantastic. We've grouped it really into three areas. So there was a strand emerging around the work that needs to be considered for patient engagement, patient focus in 7-day working and community-based services. So there was a strong message coming on about the use of approaches to patient activation in their own care, health coaching being used as one example, but the advantages of doing that because patients are their carers 7 days a week already, so let's make best use of that. Some great examples coming through about the Airedale pilot from the Prime Minister's Challenge Fund and the use of remote working telemedicine solutions in nursing homes to allow GPs to manage their own patients into the out-of-hours period and reducing the total demand on out-of-hours services there. The Great Yarmouth and Waveney experience in an integrated service across the whole system, which you've just been hearing about, and the importance of the competency framework to give integrated teams that manage all the eventualities, and the importance of stakeholder engagement, talking to customers and service providers about what the right approach is, and that keeping the focus, as we've done today, right from the beginning, on the quality and safety aspects of 7-day working is a really important focus to get you through the difficult conversations and into a solutions focus rather than should we do this or shouldn't we. A theme around challenge is emerging, so certainly the setting of standards is really important. We've got the 10 national contract standards being introduced, but getting to agreement on those early is a really important enabler for the conversations. IT is a repeated theme that's come up, so the importance of being able to measure the success of what we're doing, but also to be able to collaborate on the care of patients across different service providers at different times is important. Some great experience from the East Midlands team there on the mileage that they've got in collaborating between their hospitals already on PACS and RIS systems and pathology as enablers for those IT discussions, and can we make more of those? The importance of rapid learning cycles amongst the clinical community and the organisations involved in these changes, and the beneficial effects of audit and feedback on performance. The importance of diagnostics, but that they shouldn't dictate the pathway, and the importance of being able to upskill staff and make the best use of skill mix in clinical science services as well as frontline clinical services. Getting on with doing the NHS IQ baseline tool, not getting left behind in the process. Keeping things simple, so the learning from the London experience that setting too many standards is just as bad as not setting enough. So trying to keep things simple and move things forward using a small set of standards. And the importance of making the conversations about standards and performance transparent and public as early on as possible to drive some of the conversation. And then finally, a theme about exploring and taking the first steps on this, listening to the customers, talking to the customers to help shape the work that we're doing, because that is the people who will get the benefit from it. Being open to innovation and being bold in our willingness to experiment, keeping our eyes on the prize, focusing on the outcomes we're driving after, particularly in terms of quality and safety, remembering that a one-size-fits-all workforce isn't really an option for us now. We have to start exploring some skill-mixed workforce and some newer approaches to solving our workforce challenges. Training our workforce to the local market to improve retention and recruitment, which is really important in some of our more challenged areas. Skill mix we've talked about, and going beyond the baseline assessment into assessment sufficiently detailed for organisations to start to make business cases to support this change, because that's where the real difficult decisions have to be made. So that was a quick run through of the workshops today. Thank you.
Thank you. Well, I'm going to be very brief, so we're going to finish ahead of schedule, which I'm sure no one will be too disappointed at. First of all, I'd just like to say that I hope everyone will take away from today a compelling need to try and make things change, to try and make things improve for the good of our patients and the population. We have heard and seen hard data that shows things such as mortality rates are impacted by the failure of us to provide adequate care out of hours, particularly at weekends and bank holidays. We've heard some very, very compelling patient stories about the impact on individuals, both in terms of outcome and patient experience, if we don't get things right. So I think it's for all of us to try and move things forward. As the Clinical Senate, our main focus is on patient-focused care and high-quality outcomes. The management structure of the NHS is going to try to encourage you to do the right thing by ensuring that these standards are worked towards in commissioning units and provider units across the trust. We as the Senate are here to try and help you achieve those things for the good of patients. We will use the Assembly members, the Council members, and if necessary, external experts, if you require our assistance to achieve these improvements. Some big themes, and Shane's covered nearly all of those themes already, but I'll just quickly whiz through them again, some of the themes that have come across. Number one, the patient focus. So if we don't think about the patients, and I think everyone in the audience probably more impacted by some of those really quite emotional stories, makes it much more meaningful than just looking at the data. But we've also heard about the coaching of patients and the empowerment of patients and how they can get involved in their own care, and that includes out of hours. There's an awful lot about working together, and that's working together not just integrating in the local area, but we've also heard about working together with the patient, but also working between trusts. Some of the higher tech end of services we cannot deliver in the smaller units. And so we had the case of a couple of times came up, for example, MRI services and the potential impact on a patient if we don't provide that service in a timely manner. So we need to work together right from the patient and the carers at one end, right the way through to the tertiary units at the other end. Staffing and workforce has been another key area that's come up multiple times. We need to think innovatively about new roles and new tasks that people in existing roles can take on, but we also need to plan better to try and make sure we have the right competencies in place at the right time to make sure we get it right for our patients. Again, on several occasions, we've heard the key role of diagnostics and the importance of having timely diagnostics, whether it be something simple as assessing someone who's got a urinary tract infection to the patient who's got the potential spinal cord compression at the other end of the spectrum. From the simple to the complex, we need to get it right, it needs to be timely. Communication. So we've had communications come up so many times. Communication with the patient, empowering them, the coaching element of communication, but also breaking down some of the hierarchy, potentially in some organisations, to make sure that every member of staff feels they can say what's required to make sure that the patient gets a good outcome. And linked with communication, in part, IT systems that work to make sure that we can communicate between organisations, but also IT systems to help us get the right data to analyse where we need to improve, the right baseline data, and to ensure that we are changing things for the better. And just to finish off with, in terms of my summary of the key themes, I'd just come back to that patient focus. I think if we keep that at the forefront of our minds whenever we're doing anything, particularly as we're looking at trying to introduce better 7-day services, that's going to be the key, and that's the way to try and win hearts and minds as we move forward. So, in terms of where next, we will be producing the short summary document in a timely manner. We're going to try and turn it around in the next 2 to 3 weeks as a maximum, and then we will be trying to produce a more detailed document, and I'd be most grateful if the speakers and workshop presenters would help us with that piece of work. So we'll have something available for anyone across the east of England to look at and use to help them in their local healthcare system. So that really brings us to a close today. But I'd just like to reiterate that the East of England Clinical Senate Council and Clinical Senate Assembly, we are up and running. We hope you've had a useful and informative day, helpful day today, that we are here to try and improve the care of our patients and the population in general, and we will do whatever we can to support you both as commissioners and providers in achieving that. Thank you.